OpenAI now generates $2 billion in revenue every month, and it just launched a product it's giving away for free. On April the 22nd, 2026, the company released ChatGPT for Clinicians, a specialized version of its flagship AI, available at no cost to verified physicians, nurse practitioners, physician assistants, and pharmacists in the United States. This isn't OpenAI's first move into healthcare. In January 2026, the company launched ChatGPT for Healthcare, an enterprise product designed for health systems. According to Fierce Healthcare, early adopters include Boston Children's Hospital, Cedars-Sinai, Stanford Medicine, Children's Health, Memorial Sloan Kettering, and UCSF, among others. ChatGPT for Clinicians is the individual access follow-up. Where the enterprise version required an organization to deploy it, this one goes directly to the clinician. It runs on GPT 5.4, OpenAI's most capable model, wrapped in a harness that includes tools for retrieving evidence from millions of peer-reviewed studies. To measure performance, OpenAI released a new open benchmark called Health Bench Professional. It contains 525 physician-authored tasks across 3 categories: care consults, writing and documentation, and medical research. According to the benchmark paper, GPT 5.4 running inside the ChatGPT for Clinicians harness outperformed base GPT 5.4, all other evaluated models, including Claude, Gemini, and Grok, and human physicians. That human baseline was given unbounded time and full web access. It's a striking claim. But it's worth noting that the benchmark was designed and released by OpenAI itself. No independent third party has validated the methodology, the scoring rubric, or the selection of physician graders. On safety, according to Fierce Healthcare, OpenAI's physician advisors tested 6,124 conversations across clinical care, documentation, and research before launch. They rated 99.6% of responses as safe and accurate. The company also says its advisors have reviewed more than 700,000 model responses, reflecting real-world usage patterns. Those are OpenAI's own figures, relayed through trade press. What remains unclear is how safe and accurate was defined, what the failure modes looked like in the remaining 0.4%, and how edge cases, rare diseases, complex drug interactions, were represented. On the practical side, the tool includes some features aimed squarely at clinical workflow. According to the decoder, clinicians can build reusable templates called skills for things like referral letters, prior authorizations, and patient instructions. Reports also suggest that eligible evidence reviews conducted in the tool can count toward continuing medical education credits, though no source identifies the accrediting body or spells out the mechanism. OpenAI has stated that conversations will not be used for model training. What this launch signals is a deliberate strategy. OpenAI is embedding itself into the daily routines of individual clinicians, not just hospital IT systems. The free pricing lowers the barrier to near zero, but significant questions remain unanswered. How does OpenAI verify licensure? Who bears liability if a clinician acts on a flawed recommendation? And where does the FDA stand on tools like this? None of these are addressed in any public source. For now, this is a company betting that if it can reduce the hours clinicians spend on paperwork, adoption will follow, and the harder questions will be answered along the way.